The main control of blood vessels is the inner lining. That's where a lot of the chemicals originate that make it open up or close down. Endothelin is one of the chemicals that causes the blood vessels to constrict, and nitric oxide is one of the chemicals that causes it to relax. That is how the Viagra-type medications work for people with high blood pressure of the lungs. But it also has that effect on the regular circulation, not just in the lungs, but also in general. And that has to do with nitric oxide. Nitric oxide is a chemical that is stimulated by lisinopril, monopril, but also Lipitor, Crestor, Vytorin, and this new beta blocker that I had mentioned earlier, for which I am a speaker, let's be clear, Bistolic. It is not because I am a speaker that I recommend that drug. It has much theory to support it, and this is typical. Predictors of endothelial, that's the lining of the blood vessels, endothelial functions in employees with sedentary occupations in a worksite exercise program. And so what I'm saying here is that exercise has a beneficial effect on the lining of the blood vessels. And of course we know that, but do we do anything about it? So please try to get your exercise going. Just start with 2 minutes a day, 1 minute a day, 5 minutes a day, and work up to whatever you can do. The ideal is 1 to 2 hours a day, 7 days a week. And I don't say that with any sense of criticism and with every sense of encouragement. Beta blockers benefit people with lung disease despite concerns. There is literally a guideline that says do not use beta blockers in patients with asthma. And I've reviewed several studies that show that not only is that safe, but it can be very beneficial if there is an indication for such. And I encourage this backward thinking about not using atenolol, toprol, Bistolic, and once again, to me, the best of the lot is Bistolic because it has a beneficial effect on insulin levels and it has a beneficial effect on nitric oxide to benefit patients with lung disease. It's not like I want patients with asthma to get this medication. What I'm saying is very gradual and careful introduction of beta blockers, selective, cardioselective beta blockers. It may prove to be a benefit in people with lung disease. Here's an article about routine fasting in patients. I think they studied Mormons, members of the Church of Jesus Christ of Latter-day Saints, Mormons, in Utah have lower heart disease death rates than others in Utah and in the U.S. I'm translating a little bit. And they have periodic fasting, which makes that of value. Here's an article, Further Evidence Supports Vitamin D Deficiency Link to Coronary Heart Disease. And so, again, one should be exercising, getting out in the sun and getting your sun that way, but if not, then you ought to take vitamin D, is my recommendation. Proton radiation linked to lower risk of second cancer. You know, when you get a cancer, 1 minute. When you get a cancer, you get X-ray therapy, and there are 3 different hospitals with 3 different types of beams. Well, it turns out all of that radiation is not good for you, and some of that radiation will generate a second cancer. This study says that if you use proton beam radiation, you're less likely to get that second cancer, but there is no improvement in the cancer that's being treated in terms of your survival. Here's an article that's going to shock more than a few people. If you take vitamin C while you're getting chemotherapy, it may reduce the benefit of that chemotherapy. Finally, it turns out that Prilosec may interfere with the action of the anti-clotting medication Plavix, and so you need to be aware of that. Well, I'd like to say good day and God bless you all. I am H. Robert Silverstein, MD, for the Preventive Medicine Center. With questions, please call 549-3444, and my appreciation to West Hartford Cable Access TV and all the people who work here for allowing me to come do these shows.
There was a woman in Georgia, didn't feel just right. She had fever all day and chills at night. Now things got gotten worse, yes, a serious bind. In times like this, it takes a man with a style like getting out of a bind. A doctor